that around 50 to 60 millions of Indians are suffering from mental disorders. Yet, this problem is not recognized as a serious problem in our country. This issue is highly neglected. Suppose that if you got hurt in your legs and arms, or you made an accident and your head has been damaged, you visit to a doctor to consult that why you hurt in your legs and arms. Then what happened in the case of mental disorders? If you're not feeling mentally well, why you're not visiting to the doctors? Why you're not consulting the psychologist? Hello and welcome to the special session of Drishti IAS. I am Ritu and today's session is about World Mental Health Day, and this session is important for your GS 1, 2 and also for your essay and ethic perspective. So moving towards the points of discussion part. So first of all, we are going to discuss the few case studies, and in this case studies we have taken an example of eminent personalities that despite of having their good career, they had faced the mental health issues. Then we are going to discuss about the World Mental Health Day and theme, mental health problems in India, consequences of mental health challenges, social cultural factors influencing the mental problems, and then access to mental health care in India, policy recommendations, and UPSC questions, that is this topic is important for your UPSC examination or not. Then we are going to discuss practice question for prelims. So moving to the first aspect. So here we will going to discuss about the Michael Phelps. So Michael Phelps is a sports person. This is the picture of Michael Phelps. Michael Phelps is a sports person and he is 5-time Olympian, and he recently spoke against the mental health, and he says that there are many instances when we feel lonely, but we do not consider this as a serious issues. So he says that depressions, and one of the hardest lesson he learned that how to be vulnerable and ask for help. So what this line says that one of the hardest lessons he learned was how to be vulnerable and ask for help, because he is a sports person. So many times people did not assume that this person can also face problems. This person can also feel vulnerable. So he says that it's very difficult to open up about your vulnerabilities, that I am vulnerable, I am facing such kind of the mental crisis. And he had released a documentary which name is The Weight of Gold. The documentary name is The Weight of the Gold, and he had inspired many others to come and speak about their vulnerable conditions and to speak and vocal about the mental health condition. So here he had spoken about the depression condition and other vulnerable condition related to any person, whether it can be a sports person and whether it can be any normal citizen of this country. So this is about the Michael Phelps. Now we'll come to the story of Abhinav Bindra. Everyone knows Abhinav Bindra. Abhinav Bindra is a first individual Olympic champion of India, and recently he says that he was awestruck with his gold because he was the first individual who had obtained gold medal in Olympics, and for 15 years he was into that dreamy land. But after 15 years he also felt some problem, and he gave a rare insights to these kind of mental health issues, and he says that he sought professional help to tide over the mental crisis, and he quoted that I had to share my vulnerability, I had to speak frankly and honestly to empower other athletes. Why we have taken examples of Abhinav Bindra and sports person like that? Because many of us assume that they are the big persons, they have achieved so much, so might be there are chances that they can't be vulnerable. Despite of having a huge achievement, they can also feel vulnerable. And as a normal citizen, as a common citizen of this country, there are many issues, the family issues, the career issues, the financial issues one can face. So all these examples shows that they are the athletes, they are the eminent personalities, they have media exposure, they do not have financial crisis. Still, they can be also vulnerable, and they had also sought the help of psychologists and other mental health professionals to cure themselves. Now we'll come to the example of Virat Kohli. I think this man does not need any introduction. He's a super batsman of this country, and he is regarded as one of the world's best batsmen. And he also felt vulnerable during the Asia Cup. So before Asia Cup 2022, he said that in a full room when there is a lot of person, he used to feel lonely. And why he used to feel lonely? Because of the mental health issues. So the persons like Virat Kohli, who is a greatest batsman of this country, can feel vulnerable. He can also feel alone. Despite of having huge achievement, despite of having huge awards in his name, despite of having huge records in his name, he also felt vulnerable. He also felt alone. So these examples shows that your career, your batsmanship, your any kind of financial situation will not prevent oneself from the mental health problem. If you are developing such kind of the problem, you must seek professional. And first you need to acknowledge this thing that I have been facing such kind of issues. These are the person who are very brave, who came in front of media and who acknowledged their problems, that they also felt vulnerable, they also felt mental crisis in their whole career life. Now we'll come to the World Mental Health Day 2024. So World Mental Health Day is observed on 10th October every year to raise awareness about the mental health issues and mental crisis faced by so many persons. And first it was celebrated in 1992 by an initiative of World Federation for Mental Health, a global organization dedicated to promoting mental health worldwide. So when it was first celebrated, in the 1992. So here we come to the theme of the mental health. So this year we have mental health at work, and in collaboration with its partner, World Health Organization is emphasizing the crucial link between mental health and workplace. So as you already know that we have heard so many news where employees and employers both are in a very hectic situation and they are facing so much of mental health issues. And we have heard many issues where employees are committing suicide, they are falling ill because of the mental health issues. And the reason is that they are not acknowledging this fact that they are suffering from mental disorders. So it's very important to have a discussion on work-life balance and mental health, because many of us are spending 9 to 10 hours at workplace and we are not recognizing this fact that we can also be mentally ill. So that's why WHO has recognized this crucial problem, and that's why we have this theme, mental health at work, because many working professionals are facing so many mental crises and they are unable to open about their problems. So here we'll come to the mental health problems in India. As I have already told you that last year data shows that around 60 to 70 millions of Indians are suffering mental health disorders, and we are not recognizing this fact. So mental health disorders are a big issue in this country and also very much neglected. Whenever you discuss your mental health issues with anyone, that I feel depressed, I'm not feeling well, I'm feeling so much of mood swings, there are so much mood swings are happening, my mind are not working. In that condition, many will advise you, this is not a problem. You are just exaggerating this thing. It's your just own problem. This is not a serious issue. Yet this is a serious issue. And if these things are continued, you should definitely seek a doctor, mental doctor. So with vast population and diverse demographic, India comforts a substantial mental health burden that warrants urgent attention, and it has impacted the individual life, work lives. And as we have discussed that this year we have theme of the mental health and mental health work balance. So if you are not feeling mentally well, your personal life will be also affected. your work life will be also affected. And as you already know that we are of a huge population, and in this population we hardly recognize the facts like that after having 10 to 12 hours of work, one can be mentally depressed, and it can be called as a functional depression. So that's why it's very important to have a discussion on mental health, especially in country like India, where this issue is not considered as a serious issue, and many of us does not consult doctor. So this is about that. And for the first time, Economic Survey 2023 and 4 talks extensively about the mental health. As we have already witnessed that during pandemic, many big names have committed suicide, many felt ill because of the mental disorders, because they had not recognized their mental disorder. They had not open about their mental disorder. They had not open about their vulnerable condition. So here we'll come to the mental health as a principal impactful driver of the individual and national development. So this has been advertised and this had been advocated by the National Mental Health Survey 2015 and 16. And here we have a data: 10.6 adults with mental disorders, and treatment gap is 70 to 92%. So we can see that how much treatment gap we have. It means that we have so many population who are suffering from mental disorders, but they are not seeking doctors, they are not seeking professionals to have a cure to their vulnerabilities, to have a cure to their mental crisis. And it seems that irritation, mood swings have become part of their life. Now we'll come to the discussion about the prevalence of mental morbidity by reason. So people can die also because of the mental disorders, sometimes natural death, sometimes they are so much of irritation that they left their food, they left their work, and into that kind of stress situation they die, and some commits suicide. So it all shows that you become mentally weak and you become physically weak, and sometimes many of us die also. If you'll see this region, that region wise how morbidity is an issue. So urban metro, it is a huge issue. Around 13.5% mental morbidity we can see into the urban areas. We'll come to the rural areas, it is half, which is 6.9%. And if we'll come to the urban non-metro areas, it is lower than even rural areas, 4.3%. But what we have seen here, that in urban areas, this problem is huge. Now we'll come to the next one. So the survey highlights that increasing prevalence of poor mental health among adolescents exacerbated by the COVID-19 pandemic. I have already discussed this thing that during pandemic we have heard very unfortunate news where so many big people had committed suicide. They had everything, they had name, fame, money, but they had committed suicide because they were not mentally well. And they were not able to tell these things around their fans, around to their parents, that they are not feeling mentally well, and they committed suicide. So it's very important to have this discussion that this thing has been increased in pandemic, because pandemic was the time many of us felt lonely, and this was the time many of us lost their work, many of us lost their loved ones. So that has created a huge mental crisis, not just in this country, but around the world. So here we had discussed about the adolescents. So prevalence of mental health issues among adolescents during COVID-19. So percentage was anxiety 11%, extreme emotions 14%, mood swings 43%. So we can see that so many people are having such kind of the issues, and many of you have also developed such kind of the issues, but you have not sought to the doctors, you have not consulted to the professionals, because you have considered all these things are the normals and you're part of usual life. But in the long run, it can affect your mental health and eventually your physical health also. So here we'll come to the consequences of mental health challenges. So immense personal anguish and distress because of the mental health issues. We can develop these kind of things, as these conditions often impair their ability to lead fulfilling lives. We had already discussed that because of these kind of things, people live in a very distressful situation. They may encounter difficulties maintaining relationship, pursuing education, employment opportunity, and participating in social activities. So many students are not feeling mentally well because of their board pressures, because of their peer pressures. So if you're not feeling mentally well, it can hamper your education, it can hamper your work life, it can hamper your personal relationship. Suppose that you are married, you are dating someone. In that condition also, if you're not mentally feeling well, your behavior could impact others, and sometimes you have to face extreme consequences. Sometimes people break their relationship because other person is not feeling mentally well, and other person is unable to recognize that why so and so person is behaving in a different manner. So this is a very serious thing. Decrease productivity, because if you're not mentally well, you cannot focus on your work, you cannot focus on your studies, you cannot focus on your personal relationship, you cannot perform in a society, you cannot perform anything. So these is that it decreases your productivity. Suppose that if you are able to complete a task in 10 hours, and if you're not feeling mentally well, you can take maybe 20 hours, 15 hours, because it has decreased your productivity, because your attention is somewhere else. Mental health issues often lead to the absenteeism, reduced work efficiency, and long-term disability. So we already had discussed that because of all these things, people remain to be isolated. They don't want to share their lives with others. So there is a sense of absenteeism, that they do not be a part of any society, they do not be a part of any group. So these kind of things, they avoid people. So these are the challenges and consequences we have. Now we'll come to the social and cultural factors influence the mental health in India. Societal stigma and discrimination. As I have already told you that mental health is still treated as stigma in the society, and there are inbuilt issues. Suppose that we have so much discriminatory policies in the society. This is not made by the government, but this is the societal problem. We have the caste problem, we have the gender problem, we have the class problem, we have the regional problem. And because of the discriminatory behavior, many of us felt very insecure about their identity, and that can also lead to a mental health issues. We have seen that many of the bright students who belongs to a marginalized community had committed suicide because they were isolated in their campuses. Recently, so many IIT students who belongs to a marginalized community had taken extreme steps because they felt discrimination in their campuses, and because of that they have been mentally impacted, and they were unable to share all these things because this issue has been not recognized. Suppose that if you share this problem to their peer friends, to their faculties, to their teachers, many teachers will not recognize, and they say that this is not a serious issue, you are exaggerating these things. Your friends will say that you are overthinking, it is not a big issue. But sometimes it can be very much harmful for those students, and they're bound to take extreme steps. Here, gender inequalities, as you already know that despite of having a constitutional norms that everyone is equal in this country, the inequality persists in our society. We do have gender inequality in our society in terms of marriage, in terms of education, in terms of dowry, in terms of everything, and that creates a huge mental issues among women. And women are not exposed much. They have received very less exposure in comparison to men. In that sense, they are not vocal about their mental health issues, and sometimes they take extreme steps. Suppose that of many domestic violence, sexual violence, women are forced to take such kind of steps. So because of gender inequality also, mental crisis begin. So sometimes mental crisis begin by own, and sometimes it is formulated by the society, and sometimes people are bound to take such kind of the steps. Now we'll have another one, which is poverty and socio-economic factors. So millions of Indians are living below poverty line, and this can be also one of the reasons that people can feel mentally sick, and they are mentally sick because of their socio-economic condition. You can see that in Vidarbha region, so many farmers have committed suicide. And why they had committed suicide? Because of their socio-economic factor. Because they were not getting desired help. Their crops were not yielding. Here, rapid urbanization and migration. So in search of jobs, many people from rural areas migrate to the urban areas. And in pandemic, what we have seen that many daily wage workers are forced to go on foot to their native places. What it shows, what their mental condition. Many of them had died on the road also. What's the mental condition of that family? So this is also one of the reasons that due to migration, due to urbanization, people feel lonely and they left their family, and that will create a situation of mental crisis. Family dynamics and societal pressure. So family dynamics is also one of the things. Right now, divorce is rising day by day. People are moving towards the nuclear family. It can be personal choice to everybody that they want to be a part of nuclear family or they want to divorce someone. And sometimes family structure is dysfunctional. But if you'll see in a longer run, that can also have a very huge impact on mental health. Suppose that if there is a child and their parents got divorced and their parents are not equally paying attention on the child, in that situation, there are chances that child can feel mentally sick. So this is also one of the reasons that dysfunctional families are growing day by day. People are giving importance to the individuality, and there are chances that these all factors can affect a mental health of a person. Now we'll come to the next one, which is about the access to mental health in India. So here we have few challenges. Shortage of mental health professionals. This is widely acknowledged that we do not have mental health professionals. We do not have such kind of facilities. Inadequate infrastructure and resources, lack of awareness and stigma, insufficient integration into primary health care. So all these problems are interlinked with each other. First of all, we treat mental health as a stigma. Suppose that if any person has a bipolar disorder, people call with them very derogatory words. So this is treated as a stigma. There is a lack of awareness. Suppose that if any person is feeling anxious for last 2.5 months, in that case also people will not take that person as a serious problem, and the person can feel anxious for years also, and that will develop a big mental health issues. And insufficient integration into primary healthcare. So our primary healthcare does not have a psychologist facility, psychiatrist facilities, neuro facility where people can go and discuss their issues. Here we'll have national key government initiatives and policies. National mental health program. Under the district mental health program of this scheme, more than 1.73 lakh sub-health centers, primary health centers, urban PHC and urban health center wellness centers were upgraded to Ayushman Arogya Mandirs, providing mental health services. So this is the National Mental Health Program. Under it, 1.73 lakh sub-health centers will be open to assist people mentally. National Tele-Mental Health Program. If you are unable to go to any clinics, you can call onto the number, and with over 1600 trained counselors in over 20 languages, 53 tele-manas cells were set up in 34 states and union territories, and more than 8.7 lakhs calls handled since October 2022 to as of 31st March 2024. So we can see the effective usage of such kind of tele facilities where people are calling and discussing their problems. Then we have increasing mental health personnel. 25 centers of excellence were sanctioned to increase PG students intake. 19 government medical colleges institution to strengthen 47 PG department. So aims are also facilitated to have facilities of mental health issues. So these also is that the government is trying to increase the number of mental health professionals. Rashtriya Kishore Swasth Karyakram, adolescent friendly health clinics and peer education programs were conducted across the country. So we have seen that in adolescent these kind of problems are developing a lot. So that's why the government has launched Rashtriya Kishore Swasth Karyakram. Then policy recommendation on mental health economic survey. So what economic survey 2023 and 4 says about this? So redoubling efforts to increase the number of psychiatrists from 0.75 psychiatrists per lakh population in 2021 to WHO norm of 3 per lakh population. So we do not have even one psychiatrist per lakh population. So WHO has recommended that at least we have to increase it by 3. Comprehensive guidelines for the excellence centers services alongside the mental health professionals and users to understand their needs. Nurturing peer support networks, self-help groups and community-based rehabilitation programs. So we treat it as a stigma, but if we have facilities like rehabilitation program, SHG groups, community development, so these all can also assist a person to prevent themselves from their any mental crisis. Sensitization of mental health. So we have discussed that we use derogatory word if any person is suffering from any kind of mental health issues. So that needs to be stopped. We need to have sensitization and awareness that we have to treat those person with compassion. And standardization of guidelines. Many guidelines are vague in structure, especially in private sector, so that need to have a particular standards. Then effective pathways for integrating mental health intervention in schools, including developing age appropriate mental health curriculum. So schools should also have a mental health curriculum so that we can have this kind of awareness since childhood also, and according to your age there can be a different kind of curriculum which can suit to the different kind of age groups, that this age group can have this kind of problem, this age group can have a particular kind of problem. So a curriculum should be designed to fulfill the needs of every age group of the students and bottom up whole of community approach. So we need to start from the bottom up, especially among the marginalized communities, especially from the rural communities, and we have to go to, because in cities there are so many professionals, there are so many facilities available, but in rural areas and the people who lacks money does not have this kind of access. So that's why it's very important to have bottom up approach. So Drishti IAS has also organized mental health workshops in Jaipur and also in Lucknow. So these are the pictures of mental health workshop for the students where so many experts have been called out and student had asked their queries related to the mental health. So this is also a kind of awareness program by Drishti IAS, where Drishti IAS had thought about that our students should not feel mentally distressed. So that's why this is also one of the thing. So here we'll come to the UPSC question, that do UPSC pays attention to mental health issues? So we have means questions. So in essay 2024, this year only, we have one thing: social media is triggering fear of missing out amongst the youth, precipitating depression and loneliness. So we have this one word which is very trending, FOMO. So this is the question related that why youths are developing this kind of tendency of FOMO, and that has created a problem of loneliness and depression. So you have to write issue onto this. Then we have another question in 2023. Explain why suicide among young women is increasing in Indian society. So we had already discussed that gender inequality persists in our country because they are so suffering from lots of sexual violence, domestic violence, educational gap, awareness problem. And because of that, women are more prone to such kind of mental crisis. So that's why suicide among young women is rising day by day. So here we'll come to the practice question. What is the theme of the World Mental Health Day 2024? Mental health is a universal human right. Make mental health for all a global priority. Mental health at work. Mental health in an unequal world. So this you have to answer. I hope you like this session. If you have queries related to the session, kindly ask in the comment section. Thank you. Have a nice day.
For more informative content, like, share and subscribe, and do not forget to press the bell icon to get the notifications.